Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 1. Pharmacology. Let's get started with question number 1. For the following case. An increase in which of the following pharmacologic parameters is most likely responsible for the longer half-life seen in certain individuals? A. Drug glucuronidation. B. Glomerular filtration rate. C. Oral bioavailability. D. Peak serum drug levels. E. Volume of distribution. The case scenario is: healthy adult volunteers are enrolled in a Phase 1 clinical trial investigating the properties of a newly developed oral antimicrobial agent. The drug is administered in different amounts to the volunteers over the course of several weeks to determine the best dosage that minimizes toxicity while maintaining through levels above the minimum inhibitory concentration. While reviewing the data, the researchers note that the drug's half-life seems to vary amongst the study participants. The question is: an increase in which of the following pharmacologic parameters is most likely responsible for the longer half-life seen in certain individuals? Your options are: A. Drug glucuronidation. B. Glomerular filtration rate. C. Oral bioavailability. D. Peak serum drug levels. E. Volume of distribution. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is E, which is volume of distribution. This question is designed with the focus to assess your ability to apply foundational science concepts. The half-life is the time required for the plasma concentration of a drug with first-order elimination kinetics to decrease by 50%. At time 0, 100% of the drug is present, and with the passage of each subsequent half-life, half of the remaining drug is eliminated. After 5 half-life intervals, a drug is almost completely eliminated from the body. A drug's half-life depends on 2 pharmacokinetic properties. Clearance represents the volume of plasma completely cleared of a substance per unit time. The clearance rate is constant for most drugs and depends on the particular metabolic conversion. Example: glucuronidation to inactive form, and/or elimination pathways. Example: biliary or urinary excretion, used to remove the drug from the body. Volume of distribution refers to the extent to which a drug distributes in body tissue compared to its plasma concentration. A drug's volume of distribution is determined by its intrinsic properties, example, lipid solubility and protein binding, as well as patient factors such as body weight and composition, example, increased fat versus lean mass. In general, a higher volume of distribution means that the drug is increasingly bound to body tissues with a smaller proportion found in the plasma. Because plasma concentrations are lower for any given dose, drugs with higher volume of distribution take longer to eliminate from the body and therefore have a longer half-life. The half-life of a drug can be calculated using these parameters, as follows. In this case, the increased drug half-life seen in certain patients is likely due to increased total body weight, resulting in a higher volume of distribution. If you choose any option other than E, you are wrong. Let's briefly discuss the other options. A and B. Drug glucuronidation and glomerular filtration rate. Increased glucuronidation or glomerular filtration would increase clearance, leading to decreased drug half-life. C and D. Oral bioavailability and peak serum drug levels. Oral bioavailability can vary between individuals due to intrinsic differences. Example: age, sex, disease, diet, and medications. Example: proton pump inhibitors. Although increased oral bioavailability can raise peak serum drug levels, drug half-life would not be affected because the amount of drug eliminated per unit time increases as the drug's plasma concentration increases. True of drugs exhibiting first-order kinetics, which account for the vast majority of all clinically used drugs. Your take-home message from this question is that half-life is a measure of how quickly a drug with first-order kinetics is eliminated from the body. A drug is almost completely eliminated after 5 half-life intervals. The half-life can be calculated from the drug's volume of distribution and clearance rate using the following equation. Are you confident about your answer? You can move on to the next question by clicking above, but only if you got it right. Otherwise, you need to watch this episode again. It's very important that you understand everything. Discover how to ace your medical exams, especially the USMLE, with our excellent resources. Help yourself and your friends get ready by liking, sharing, and subscribing to our channel. Remember, your success is within your reach.